All right, without much further ado, I'll introduce myself. My name is Brad Peck, as I mentioned, presenting to you today from Ottawa, where it's a beautiful sunny day, and hopefully wherever you are also having a lovely day. So thanks for spending the time with us today. And I'm sure you're excited to be starting, the great academic journey of studying out of college. And hopefully while you're studying, you are happy and healthy and safe. However, we do know that accidents happen. And that's why Canadore College has selected GuardMe to be your extended health insurance provider. That if you do become sick or injured, there are quite a few benefits that are included in your plan that can help you out. So let's dive in and see what those are. So first off, the identification that you'll get about your policy is a healthcare access card. So this card is a direct billing card, meaning you can take this to pharmacies to get your prescription medication billed directly to us. So you wouldn't have to pay out of pocket for eligible prescriptions, as well as the dispensing fee at the pharmacy. So please keep this with you once you have access to your account so that it can save you out-of-pocket expenses and time as well. To start off with, everyone is automatically enrolled in what's called the balanced plan. And I'll go over some of these details with you, but you do have an option to change into one of the other two plans. And, that choice is yours. You do have a limited time in which to do that. And, it'll be based on your particular health needs. So if you are, happy with the balance plan, you'll just automatically stay in that. However, if you take prescription medication on an ongoing basis, you might consider switching into the enhanced drug plan because the coverage is higher. And so you will see more benefit from that if this is where the bulk of your claims will lie. So I'll just, look at some of these different plan details with you. I can't say which one's going to be better for you, but just providing you with the information so that you can make an informed decision. So, I'll start out by saying that the dental benefit is identical across all of the plans. So, that won't impact your decision at all. That if you have an accident, which is an external blow to the mouth, we can cover up to $2,000 to repair broken teeth as a result of an accident. Not from getting cavities, not things of that nature. We don't cover routine dental exams and fillings for cavities, etc. The plan that's been selected is just for accidents. Okay. Now, where you'll find the differences in this plan are in the prescription drugs and in the extended health. So basically, paramedical benefits. So massage, physio, chiropractors, things of that nature. So if you, take a medication every day, then this would be better for you to switch into the drug plan because you're only going to pay 10% of your drug costs, and the maximum goes up from 2,000 of the balance plan up to a total of 2,500. On all the plans, we'll cover up to a $10.50 dispensing fee. I mean, very few pharmacies will charge that much, so you won't, if it's a compounding pharmacy, they might, but any Shoppers or Walmart or Costco or any of the big chains will certainly charge usually $2 or $4 for their dispensing fee. So we'll cover that at 100%. And then, your prescription medication can be covered up to $2,500 per year if this is the plan that you select. Or if you're going to stay in the balance plan, then you're going to have to pay 20% of your medication, and the maximum that we'll pay is $2,000. So for example, if your medication every month is $100, you would get covered for $80. We would pay, you would need to pay $20. And, if it's $100 a month, that's all that you'd pay because you wouldn't exceed the maximum in a year. 100 times 12, $1,200. So, you're going to have to look at what benefits you have and what routine expenses you have. If, for example, you go to a psychologist and that's where you find the majority of the benefits would be used, then switching into the enhanced extended health plan would be more advantageous for you because in this instance, you don't have to pay anything for those visits up to $400 total. Okay, so if we look at the totals here, the balance plan, you would pay 20% of those visits. We would only pay a maximum of $20 per session, up to a maximum of $300. So, this enhanced extended health plan for those who use paramedical practitioners on an ongoing basis would be a better choice for you. But you see how it affects the drug coverage here, that it decreases the maximum and increases your copay. So, in that previous example, if it's $100 per month, you would need to pay $35 per month. We would pay $65 up to a maximum of $1,000. So you're really going to have to look at your health in a holistic, fulsome manner to make that decision as to which one is more advantageous for you. So you can read all of the details on the website, and I'm just showing you that I just took a screenshot of 2 of the different plans. You can read all the details in full. So you're going to choose if you're going to stay in the 80% plan, if you want 90% coverage, or if you want 65% coverage. But some of the benefits across all of the plans are that we cover up to $15,000 for an accident. So there are individual limits within that, but I'll highlight some of those. That an ambulance is covered at 100%, whether it's an air ambulance or ground ambulance, we cover that at 100%, up to this total, but at 100%. There's life insurance included in here as well, up to $7,500 if you have an accidental death. Oops, didn't mean to advance that. The accidental coverage when you're out of Ontario, when you're out of your province of residence, is $10,000. So there's a slight limitation there in the total. I highlighted that dental accidents are covered up to $2,000. We'll cover across all of the plans. We'll cover orthopedic supplies, so like orthopedic inserts into shoes and that type of thing. They're covered up to 80% across all of the plans, up to $200 max. And then you're going to choose if you want for the paramedical benefits. The extended health plan is $400 maximum, but we cover those treatments at 100%. We'll cover up to $200 at 80%, up to $300 at 80%, just based on whichever plan you select. I do want to highlight that for these following paramedical benefits, you will need a doctor's note to access those benefits, and it should predate the service. So if you go to a speech therapist, as an example, you should get a doctor's note to qualify for those reimbursements prior to going. There is massage therapy included in your package. However, like I said, a doctor's note is required. So it's not just for a general relaxation massage. It would need to be for a therapeutic reason. But we don't require doctor's notes for naturopath or chiropractors. So please take a moment to bookmark or add to your favorites this custom website we created for you to house all of this information and to facilitate some of the online options as well, such as opting out, adding dependents, logging into my account to submit claims, and etc. So bookmark guard.me/Canadore for these resources. So to add a dependent to your plan, whatever plan you are enrolled in, your dependents will be enrolled in the same plan. So if you're in the balance plan, you can't select the extended health plan for your dependents. Likewise, the, what is it, extended drug plan. So you're all going to be in the same plan. There's a limited window of opportunity to add dependents unless something changes with your family situation. So if you get married outside of this window, we'll add your spouse. That's not an issue. If you have children outside of this window, you can add them. We just can't do it through the online mechanism. You would just need to email our admin department, which is admin@guard.me. I'll put that in the chat in a second. So there's a limited window in which you can add your dependents between September 21st, which is when we got all of your information from the college, and October 1st, October 2nd is when that window closes. So be sure to add your dependents in that window if you wish to add them to your plan. Totally optional. The price to add your dependents, single parents can enroll a child or children for, multiple children, unlimited, up to $125 per year for one or multiple children. If you have a spouse, you can add your spouse for $150 per year. And once your spouse is enrolled, there isn't any additional charge to add children. So there's these two different options, all right? Adding multiple children for $125, adding a spouse and or unlimited children for $150. So those are the two pricing structures for adding dependents. And you would do that through, let me go back here, through this link right here, add a dependent. So you'll need to log into your account first so that you can get your policy number so that you can add dependents. But if you want, I can take you to that website to show you that process. Now, one of the other features of the online account is, of the online resource of that microsite, is My Account. So this is where you can view your policy summary and that full policy wording. You can download your healthcare access card, so you can take this to the pharmacies and get that direct billing for your medication. You can submit and monitor your claims. And then there's an online chat button here with our customer care team, which is 12 hours a day from 8 in the morning till 8 at night. If you do need to pay out of pocket for medical expenses, because honestly, most paramedical providers, massage therapists, etc., won't bill private insurance. They just ask you to pay and you take care of the claims, the reimbursements yourself. So you can log into your account, you can submit them online, or you can print your healthcare access card, the bottom portion of which is a claim form, and then attach your receipts. Actually, that's on the next screen, so we'll get to that. But either way, we can reimburse you quickly and easily with a claims reimbursement card, which is a prepaid debit MasterCard, direct deposit, if you need a wire transfer, or we can mail you a check as well. So all great options. So these are for the claims that are not paid directly to the pharmacy. Those are just managed electronically, and you are, good to go on those. So if you do, I don't know if I need to read all of this out to you, but if you do submit your claims through paper or electronically, then if you do it electronically, all of the policy information is automatically transferred, right? It's from your account. It just asks you the questions like, who do we reimburse? If you have an invoice from a paramedical provider and they didn't actually ask you for payment, highly unlikely, but we can pay them directly. So you can just specify to us that we're paying a paramedical provider or paying, a hospital or whatever. But many different options for who we can pay there. We need invoices, obviously. We need to see what the amount was. We need to see if you paid for it. So we need to say paid in full, for example. We need to know the reason for your claim. So if you have a medication claim that didn't go through electronically, obviously we need to know what it's for. Receipts, proof of payment, your signature, and the date. We have customer care staff that are in office 24/7 on Christmas Day, on New Year's Day, every day of the year. So if you have emergencies, they can help you, navigate what's included in your plan, what's not included in your plan. So if it's a medical emergency, you call 911, get an ambulance, go to the hospital. But if you have questions about what's included in your plan, call us, email us, use the chat feature, and we're happy to answer your questions. We have lots of staff that are standing by at the ready to answer your questions. So that's about it for the formal presentation, pretty short and sweet. Happy to see if you have any questions. I'll just stop the recording.